Are you feeling tired all the time? Getting sick more often than you'd like? Or maybe you're dealing with nagging back pain that just won't go away. You might chalk it up to stress or a busy life. But what if the real culprit is something you're not even thinking about? What if it's a silent deficiency in the sunshine vitamin? That's right, we're talking about vitamin D. Your body actually makes it from cholesterol when your skin is exposed to sunlight. It's crucial for strong bones and a rock-solid immune system. In fact, it's so important that it's been linked to protecting against a whole host of chronic issues like heart disease, type 2 diabetes, and even depression. But here's the shocking part. It's estimated that 1 billion people worldwide have low vitamin D levels. In the US alone, that's almost 42% of adults. For some communities, like African Americans, that number skyrockets to over 80%. Getting enough from food alone is tough, even with fatty fish and fortified milk. The recommended amount for most adults is around 1,500 to 2,000 international units, or IU, per day, which is a hard target to hit with diet alone. So, how do you know if you're one of the many people running low? The signs can be sneaky. They might not show up for months or even years. But one of the biggest clues is frequent illness. If you're constantly catching colds or the flu, it could be a sign your immune system isn't getting the vitamin D it needs to fight off germs. Studies have even shown a link between low D levels and a higher risk of respiratory infections. Then there's fatigue. We all get tired, but if it's a deep, persistent exhaustion that sleep doesn't fix, a vitamin D deficiency could be to blame. It's often overlooked, but some studies have found a strong connection between low vitamin D levels and self-reported fatigue. Bone and back pain are another major red flag. Vitamin D is essential for helping your body absorb calcium. Without enough of it, you might experience aches, particularly in your lower back. Some research even links low D levels to more severe pain in people with chronic pain conditions. And it doesn't stop there. Slower wound healing, hair loss, unexplained muscle pain, and even feelings of depression and anxiety have all been linked to not getting enough of this vital nutrient. People with darker skin, older adults, those who are overweight, or live far from the equator with less sun exposure are at an even higher risk. Even working night shifts or spending most of your time indoors can put you at risk. Think you might be deficient? The only way to know for sure is a simple blood test from your doctor. They can measure your levels and determine the best course of action. Usually, treatment involves taking oral supplements. Your doctor will recommend the right dosage for you, as taking too much can also be a problem. They might also suggest eating more vitamin D-rich foods like fatty fish, egg yolks, and fortified cereals and milk. And of course, there's the natural route, a little more time in the sun. Just be smart about it. Limit your exposure and always wear sunscreen to protect your skin. Fixing a vitamin D deficiency is simple, and the long-term benefits for your overall health are absolutely worth it. If any of this sounds familiar, talk to a healthcare professional. It could be the first step to feeling like yourself again. Thanks for watching. If you found this helpful, give us a like, and don't forget to subscribe for more health tips to help you live your best life. Stay sunny.